Hi, and thank you so much for tuning in to Connecting Communities to Healthcare. My name is Dr. Shalonda Crawford, or Dr. Sunshine, and I'm the co-chair for the First Lady's Health Initiative. I'm also the co-pastor of the Experienced Christian Ministries, and by profession, I am a licensed psychotherapist. I am thrilled to be here today collaborating with Covered California and with my special guest, Dr. Monica Soni. Thank you so much for being here today.
Thank you for having me.
Would you like to tell us a little bit about yourself?
Sure. Well, as you mentioned, I'm Monica Soni. I'm the Chief Medical Officer at Covered California, and I'm the Chief Deputy Executive Director over the Equity and Quality Transformation Division. And I'm a practicing primary care doc still.
Yes, it's like we have all these hats.
That's right.
We're doing all these different things at once. Well, I have some what I consider very important questions to ask you with the hopes that we can better inform the watchers, the listeners, the community in general.
Perfect.
Well, I'll tell you. Well, first off, let's get started right the most important thing here. What does health equity mean to you personally?
Yes. Personally, what it means to me is that we all have the opportunity to live our best, fullest lives. And that means all of us, right? The most holistic part of us. Mental health, physical health, social environment as well. All of those, economic mobility, everything included in that is that if you're able to achieve that, you're achieving your health equity, equitable outcomes.
Do you believe that there is equity in healthcare?
I believe we can achieve equity in healthcare. I think we've got decades worth of data that shows that we have not achieved it yet. And actually, depending on how you slice the data, all of us have inequitable outcomes depending on where you are in your life, where you live, your income level, your education level. So we can achieve it, but we have not yet.
So for the sake of the conversation, where are you seeing disparities or inequity?
Yes. I like to use this particular example because I think it challenges us to think about how do you actually get there to that destination. So Black women, we have 2 times the rate of mortality from breast cancer as we do our white counterparts. We get mammograms at higher rates than our white counterparts.
That's interesting.
That is interesting. It's not an education gap. It's really not an access gap. Something else is happening from the time you get the mammogram to the time that you have a bad outcome. That is what you have to interrogate to figure out how to get to equitable outcomes.
Have we figured that out in any kind of way?
We have not figured that out.
So that's still a mystery?
That's still a mystery. There's a lot of hypotheses, but there isn't actually an answer to that. So that's just a good example, right?
That's a great example, and that's mind-blowing.
That's right. We're doing our part, and yet we're still dying at twice the rates of our white counterparts.
Wow. Are you seeing outcomes like that in other areas of healthcare?
Absolutely. I'll give another example. We look at our behavioral health utilization. This is an area near and dear to your heart. And we look at, what are the rates of behavioral health visits per 1,000. We stratify it by race, ethnicity, language, income, et cetera. Folks that identify as Asian or Asian American have the lowest rates of behavioral health utilization, no matter how you slice or dice the pie. No matter what health plan they have, no matter what income level, even language is not actually the prevailing issue there. And so there's lots of hypotheses as to why, but actually, do we have the answer? Not yet.
We just don't.
Yeah.
I mean, there is a hypothesis that comes to my
Yes.
mind, but I guess I don't know the answer.
Well, that's right. And I think that's part of health equity work, right? We have to listen to people, talk to people, ideally co-create with folks. And we have to have hypotheses, and then we test. Did that make a difference? We measure, we report out on it, we take it back to community. Did that make a difference? And most of the time, it's not one thing, right? Multiple interventions are needed to be able to have the outcomes that we need and want.
This brings me to another question, which is the trust and mistrust that impacts whether or not people are seeking healthcare or or even healthcare coverage.
Yes.
So I don't know. I have personal stories about that, but I'd love to hear what you have to say about it from your perspective.
Right. So I'm a government employee. And I will say, has the government always been a trustworthy institution? No.
I mean, a raving no,
No.
right? Yeah.
Right. So it's less about, do I think, is a community, trusting, and more, are we institutions that are deserving of that trust? And do we show up in the ways that really matter and count? And so we have a long way to both atone for the harms that we have caused multiple populations, right? And not all in the distant past, some of it pretty proximal in terms of the harm that's been done.
Well, you're saying that there's harm that has been done or maybe is being done.
Yes.
But does the institution as a whole recognize that there is harm that has been done?
Yeah.
Because I think that's a good starting place, and it actually, I think it lends to the foundation of the trust or mistrust.
Correct. You have to repair. And to repair, you have to acknowledge what you've done.
Yeah.
Right.
Yeah.
I think we like to jump to the next phase of it, which is just to say, look at all the good I'm doing now.
And let's move on.
Right.
Let bygones be bygones.
Correct. But think about the hundreds of years that harm was done that require us to acknowledge, address, repair before we can really catch up to the moment.
So as a woman of color, do you see yourself addressing issues like trust issues? Do you see skepticism?
I hope I'm addressing the trust issues.
I mean, but I guess let me go further because obviously you would address it if it, but do you see people more willing to have the conversations and even ask the questions? Or, and this is going to be a twofold question, and do you also have patients in your patient care saying, I chose you because of the sameness as opposed to the difference?
That last question, for sure.
Yeah.
I mean, folks will know when I'm even out for Covered California, which is not a clinical capacity, right?
Yeah.
I'm really in an administrator role right now, but still see patients. Folks are always like, how do I get on your panel? Do you have a Black lady you can recommend to me?
It's funny because my care provider, I met on a panel like this, and I'm like, girl, do you have room? Because I love what you're saying.
I select for my family in the same kind of way that folks are looking for too. And I think, let me be very clear, this is not just about preference. There are studies that show that when you have concordance, mortality is better. Mortality is better when you have racial and ethnic concordance. Yes, this is not just preference. We live longer when we have providers that look like us. So I wanted to say, like, when you look at the data, it's clear. And I know we're in a difficult moment right now. We're in a moment where actually we cannot say these truths very easily, but that's just a fact. You can pull up the study that showed it.
So with that being said, we have to lean into this.
Yes.
When you feel safe, outcomes are better. That's basically what that's saying to me. Like, what else can you say?
And when you have a provider that's listening to you in a certain way, right? So you feel safe and you're sharing, and you have a provider that's listening and picking up on the cues. It's almost like language concordance. If we don't speak the same language, how can we understand each other?
It makes sense.
If you don't have the cultural context, how can you understand each other? So second part of the question, yes,
and then
for
we
sure.
always hear lost in translation.
Yes.
So maybe there is a certain underlying message that's happening beneath the words or whatever.
That's exactly
right. There has to be some kind of connective factor.
Yes.
That is life-saving.
That is right. And so then I think to your first part of the question, are our institutions always open to the atonement and to these realities? No, I mean, I think we're working on it, but I think the strides that we've been making are under attack right now. I mean, I think that's the truth. There are words you cannot even say certain words, and so you do see really a retraction and a retreat. I'm very grateful that that is not true at Covered California, right? I work at California's Obamacare. I run the health equity division, and I look like this, and that's my job, right? So, and there has been nothing except for support for me to continue to do my work, which is to support the health of all 2 million Californians, but also the communities that I serve.
So, Dr. Soni, what is Covered California?
Yes. So Covered California is the place where you can go to get financial assistance for health coverage. So a lot of times folks are thinking about, well, can I get Medi-Cal? Yes, it depends on your income level though. So we have folks that make too much money for Medi-Cal can come to Covered California. Folks that are too young for Medicare can come to Covered California, and folks who don't get insurance through their employer for some reason can come to Covered California. So this year we support nearly 2 million folks across the state of California. These are hardworking folks, right? A lot of folks are independent, contractors, gig workers, farmers, hairstylists, nail salon folks, right? These are all folks that usually are not getting insurance through their employer.
Yeah.
And they're on Covered California.
Entrepreneurs.
There we go, entrepreneurs.
When I left community mental health and went into private practice,
Yes.
I really turned to Cover California. Like, can you help me with this
Yes.
medical insurance gap because I'm going to be losing it there? And I was faced with several questions.
Yes.
Medicaid, Medi-Cal, Covered California. So many of us are misinformed about what those things are and what the differences are. So can you help me kind of flush out those 3 forms of healthcare?
Yes, I think that's exactly right. And I will first say you don't have to remember it. If you come to coveredca.com, we are here to help you. We've got folks here Monday through Friday. Their full-time job is just to help folks figure out this complicated landscape.
Wow,
Really,
okay.
Our full-time job is to
Wait,
help
what's the
folks.
website?
coveredca.com.
Okay, okay.
And we also have navigators, agents all across the state of California. So there are thousands of folks in community who speak the languages of the folks they're surrounded by, there to help folks navigate the system as well. This is their job.
Yeah. So Medicaid, what's the difference between Medicaid and Medi-Cal?
Yes, great question. So Medicaid is the national program based on income that gives you coverage. Medi-Cal is the California flavor of this.
Flavor.
Yes.
That sounds spicy.
Well,
Maybe sweet. I don't know.
Yeah, it's the California way that we do
Yeah.
it. Generally, we have very rich benefits. You can have a higher income and still get Medi-Cal. If you're pregnant, kids, we have very generous coverage. Some states are a little bit less generous than
Right.
California. So Medi-Cal is our Medicaid program. They're synonyms, really.
Oh, gotcha.
Yes.
Now, when I go to, tell me one more time. It's Covered California.
Coveredca.com.
Coveredca.com. We're going to say this until we have this. It's coveredca.com.
That's right.
When I go there,
Yes.
will it tell me the financial breakdown and what the criteria and all that is? Because I just think it helps for those
Yes.
folks that are skeptical, and you don't really have to lie about it. You can just know what it is up front, or guesswork, and don't, because there's the fear that I
Yes.
won't qualify or I'll be overqualified and all this stuff. So
Of
that kind of helps.
course.
The transparency.
Of course, it's very transparent. You can answer 4 questions. It's private, no one's looking at that information. 4 questions about your household size, who needs coverage, your income, and essentially it will give you an estimate of how much you might pay and who's available to you from a health plan perspective. We have chat bots. I mean, you can do whatever works for you is available so that you get the information that you
And
need.
there are different plans inside of
There's
there.
multiple different plans. We have, the Kaisers, the Anthems, the Blue Shields of the world, the regional health plans as well. Yeah, this is really commercial, best-in-class coverage across the state of California that we negotiate on your behalf for the most affordable pricing.
So you use the word coverage. What does coverage mean?
Yes. I think for me, it frankly means peace of mind, right? Because this is a little bit of a fraught area, right? Not everybody has love for insurance companies. We at Covered California are not an insurance company.
Okay,
right? I told you
okay.
I'm a government employee.
Right.
I'm here to work for California. I'm a Californian working for Californians. But we do know that medical bankruptcy is real. We know that folks are afraid if you have an unexpected health condition and you get the bill in the mail to open it and see what the cost is going to be. There are surprises that show up for folks, right? Part of what coverage gives you is peace of mind. Plus, I will say the Affordable Care Act, which got passed, has a lot of protections for us. You can't be excluded based on pre-existing conditions.
You cannot?
You cannot. Let me tell you a story.
Please.
Before the Affordable Care Act passed, I had a gap. I was finishing medical school and I had not started residency.
Right.
So I had no coverage. I went to go try to buy my own coverage. I had seen, I kid you not, a dermatologist once for a little bit of acne. A little bit of acne.
You're not going to tell me, but tell me.
I was excluded. I could not find an insurance company that would
Wait,
take
medical
me
insurance because of acne?
one visit to a dermatologist. That was the state of affairs before the Affordable Care Act. That's not even that long ago. That was, 15 years ago. We were all living in that circumstance. Women would frequently get excluded because of the chance that we might get pregnant. This was the state of affairs before the Affordable Care Act. We forget, but it really wasn't that long ago. So part of it is protections like pre-existing conditions. You cannot be excluded. And then preventive care is all free of charge. I know folks are skeptical about this, but this is the law. Breast cancer screening, colon cancer screening, diabetes screening, high cholesterol screening, and all of your vaccinations to protect your immune system, those are all covered free of charge. You can't have a copay attached to those things.
I was going to say, you mean no copay?
No copay. No
Wow.
copay, no coinsurance, none of that.
So there's really not a reason why someone in California would not be covered.
Well, I will say that if you asked me that a few months ago, I would say definitively you're right.
Okay, but
Things have changed.
yeah.
Right? We have enhanced premium tax credits, which are expiring at the end of the year. It was part of what made our health coverage in California so incredibly affordable. Plus, we got some state support too. We were able to eliminate deductibles for over 1 million people this year.
Wow.
Eliminate deductibles. That's better than many folks get through their employers.
Oh, yeah.
Incredibly affordable, robust coverage. Well, the enhanced premium tax credits expire at the end of the year.
Yeah.
So we don't know what the landscape looks like for next year. And I believe we will have, if the enhanced premium tax credits are not extended, our estimates are that 400,000 people will choose to go uninsured instead of pay what will be unaffordable for them.
So people going uninsured
Yes.
is really a rollback to like the 90s.
Yes.
So is there a plan for that?
I am grateful to be in California. We were allocated $190 million from the legislature to be able to try to maintain some affordability, but we lost $2.5 billion. We will lose $2.5 billion if we do not get the enhanced premium tax credits extended. So yes, we're able to mitigate that impact a bit more than other states are, but it's pretty tough, right? This will be a tough open enrollment, which is why it's so critical that we're out here talking to folks, that folks are coming to coveredca.com, that they're calling our line, because we're here to help folks make the decision, which is a hard decision to figure out.
So what can we, the people, do?
So step one is coveredca.com, right? If you have questions, we're doing real-time updates. Anything that's happening federally, we're keeping folks abreast.
Okay.
We're sending out individual emails, calls, et cetera. And like I said, we have thousands of enrollers, agents, navigators across the state waiting to help folks figure out how much is going to cost me, will I get support or not? And it's just about keeping your contact information up to date, really. If you're a covered California enrollee today, you've moved, your email changed, your phone number changed, please go back to coveredca.com and just update it so we can reach out to you and let you know what's coming and what support might be available to you.
Thank you for that. I want to shift just a little. So I'd like to share with you something very personal, near and dear to me.
Yes.
Years ago, I turned to the church for information regarding health and mental health care. And I did that because the church is still today a beacon of trust in the community. Can you just talk a little bit about how Cover California is joining with churches and other outlets to, service or be a resource or?
Absolutely.
Referral? Yeah.
I mean, starting last year, I'll say frankly, since I've been in seat, I have been at churches.
Mine! You've been at my church!
I have, right? And they're engaged to answer questions about anything, right? Of course, Covered California, but Covered California is not necessarily for everyone. And we feel thrilled if you just have coverage. We don't care what door you go through, as long as you have coverage. So that's right. We're out in community, we're at churches, we're at health fairs. Frankly, anywhere that folks will invite us, we will show up, because it's about going to where folks actually are and where they're receiving their health information. It's not about having to come to us to get your needs met. We need to come to you to get your needs met.
I will say that I'm hopeful that more churches, and for that matter, just community organizations with a voice and a reach will reach out to you. You coming to my church was such a lasting and impactful moment or hour, whatever it was, because you're true to that word. We could ask anything. And you were like, a book of encyclopedias. Like there was nothing that you didn't know. You answered all of our stuff, and we had stuff. So we are all still talking about you.
Thank you.
And again, the church is a beacon of trust where we can break down some of those barriers and walls in the trust and mistrust areas of skepticism.
Well, thank you for letting
Yeah.
us be there.
Yeah.
Right? It's no small ask, right, to open up this intimate space, which is not for everybody, and let us, a state institution come and be there. We're very grateful that we are starting to a little bit develop some trust across folks that, we're here to meet whatever needs are expressed, and we're flexible, and really our aim is to keep people healthy. I mean,
Yeah.
there really is no other secondary goal for us. It's just to keep people healthy. That's the vision of
To
Covered
keep
California.
people healthy.
Yes.
And that's, First Lady's Health Initiative. We want to save souls, but we also want to save lives. And so that's what we're here for. And we're grateful for partnerships like this with Covered California. So thank you so much, Dr. Soni.
Thank
Dr.
you.
Monica Soni.
Dr. Crawford.
Thank you so much.